Hi, Dr. Carly Causey here. This is Dr. Nate Moore at Seattle Sports Chiropractic. Today we're going to show you how to work on your low back, whether that's strengthening or helping with low back pain at home. So if you've been to our office before, you know we're big fans of the low back extension bench here, but we're well aware that not everyone has one of these at home and maybe you can't get to the gym. So to start, I'll just have Dr. Moore hop up here and show you how we would use this in our office. So the keys here are that we want a little bit of extension in his low back, okay? We want his hips right on the edge of the bench here, and then he's gonna feel this in his whole posterior chain. So his low back, his glutes, his hammies a little bit. That's okay, we're working on this whole chain here. Keep breathing, Dr. Nate. There we go.
I'm trying.
All right, good. Go ahead and hop down. So that's how we would use this in office. Let's give you a couple of options at home. So one option would be a bench if you have it. Also any kind of like ottoman, even a couch, anything like that we can use. So what I'll have Dr. Nate do is go with his hips right on the edge here, and then I'm gonna hold him down here, either right at the ankles, the calves. I can even go up to his hamstrings if we need. Same thing here, he's just gonna be holding, breathing, keeping his neck nice and neutral also. You'll notice he's not cranking his head up way like this. Okay, go ahead. Option 3, we would use our exercise ball here. So this is especially great, these two options, for pregnant women, so that you're not having so much pressure on the belly, obviously. He's going to grab the ball a little bit with his thighs and then also use the wall to stabilize. So you can see here, not quite as perfect. He has to be a little bit more extended, but we're still getting the same basic idea. Low back working, glutes, hammies, and he's getting a nice little burn in his low back muscles here by now. Okay, for option 4, we'll have Dr. Nate go on the floor. We call this in the clinic the poor man's low back extension. So he's going to here keep his thighs squeezed together as best he can, and then lift up from his low back, keeping his neck nice and neutral, of course, and then making sure he's breathing here. Obviously, this is not going to be a good option if you're a pregnant patient, but anyone else, this is a great option here too. We can also spice this up with some variables. We can have him do some reps with any of these where he's going up and down. So go ahead and go down to the floor. Yeah, there you go. And then come back up. And we can also do kind of your old school back and forth if we want right arm, left leg lifts. Go ahead and try some of those just to spice things up a little bit. What we found and what the research shows is that lots of time people with low back pain, low back trouble actually need some stability there. So while it seems kind of counterintuitive, it's really important that we're engaging these muscles, which really helps stabilize the spine and can take care of a lot of your low back pain, as well as just do some general strengthening. If you have any questions, you can find us at seattlesportschiro.com. Go ahead and like our page as well and subscribe if you like what you see. Thanks.